kimura, omoplata, basically with the leg, obviously you know how to do it, but it's basically the same movement as kimura. Americana. I'm gonna explain you which types of injuries we have in Jiu-Jitsu and whether they are traumatic or non-traumatic. Hi everyone, it's Andrzej Ostapko. I'm a physiotherapist based in UK, United Kingdom. I train Jiu-Jitsu under Marcello for the last 12 years on and off, with some breaks, but generally 12 years in Jiu-Jitsu, and that's why I decided to create this video about shoulder injuries related to Brazilian Jiu-Jitsu. Obviously they're not only related to Brazilian Jiu-Jitsu, but most commonly in Brazilian Jiu-Jitsu. And I will try to create more videos about this type of injuries, different parts of the body, and how to treat them, maybe how to deal with them, what are the procedures. For this video, I'm just going to explain you about two types of injuries, which is traumatic and non-traumatic. So there are basically two groups. One, which is traumatic, is result of accidents, falls, forced joint locks like kimura, americano, omoplata, where you pass your range of motion and then actually things happen. And you can have fractures. Usually the most common fracture is the collarbone fracture. You can have ligamentous damage, so you actually can damage the ligament on your collarbone and acromion, so AC joint, acromioclavicular joint. So when you separate this ligament, your bone will just pop up, and it looks like collar fracture, but it's actually not. So another type of injuries is rotator cuff tears. So the most common, I think, in my opinion, is supraspinatus tear. And obviously if something tears, it requires reattachment probably. So ligamentous, tendon tears, even muscle ruptures from now and then. Those are traumatic injuries. Another very serious injury is shoulder dislocations. Those dislocations, they require urgent medical care, and I will explain you later on why you shouldn't pop your shoulder back into the socket or ask your friends to do it. It's actually really complicated, and I will explain it later. You've got three types: anterior shoulder dislocation, posterior, which is not that common but still happens, and then inferior. And we also have non-traumatic, which is result of overuse of the muscles, tendons, ligaments. So you have bursitis, so inflammation of the bursa. You can have capsulitis of the joint capsule. You can have tendinitis or tendinosis. Tendinitis, everything with itis is current inflammation of that area. So you have tendinitis, which means it's inflammation of the tendon. Tendinosis, it's more prolonged inflammation. It's actually not acute, but it lasts for longer period of time, so you can have long-standing pain for weeks or months. Those can result in also inflammation and in tears later on. So I will explain you mainly on the issue of traumatic exercises, and if I manage today, I will also include the other types of injuries. Okay, as you can see, the shoulder joint is actually not one joint. it's a complex of joints. So this is glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and here you've got scapulothoracic joint. This is the most movable joint in human body. Now, this joint, glenohumeral joint, is a ball and socket joint. So actually, proper ball and socket is here in the hip. But as you can see, that socket is really deep. This one is very shallow. The reach here is really small. Therefore, this joint is not very stable. It's designed to move, and it has surrounding muscles to make it stable, but it's not as stable as this one. But because of all those structures, it can move better. It can move in all directions. Obviously, leg cannot do this, hip joint cannot do this unless you are Van Damme, then that's fine. So because of that shallow socket, it's very prone to dislocations. So if you have, for example, Americana movement, it can rotate and dislocate anterior. So you can actually have three types of dislocations, which that bone here, the head of humerus, can go forward, dislocate this way, anteriorly. It can go posteriorly, which is not that common, but it can happen, and also inferiorly, which is downward. So you get those type of motions. So as you can see, to increase stability of that joint, you have different muscles. You've got rotator cuff muscles on your scapula here, muscles here, muscles from underneath. This holds this joint in place, stabilizes the joint. Some of them are obviously external rotators of the shoulder, but the shoulder is the most vulnerable in 90 degrees abduction, and actually those muscles, they will not activate properly and they will not stabilize this. So actually this position is the weakest point of the shoulder probably, and that's why when you do Kimura Americana or omoplata, this causes all sorts of injuries. Now you've got the cartilage tissue here around that place, which is called labrum. This can tear during the dislocations and cause pain on you. You can have actually some impingement because of little labrum tear in here. And I'm gonna talk to you about the type of dislocations and how they happen. So not only this joint is surrounded by muscles, so rotator cuff, shoulder muscles, etc., but it has ligamentous structures. It has bursa, it has joint capsule. So when you have this anterior dislocation, this bone will actually come out and break the joint capsule, causes lots of inflammation, pain, bleeding, etc. So sometimes you can see in the movies like Lethal Weapon or whatever, they dislocated the shoulder and they will go against the wall and they smash the shoulder back, which actually is silly. Never do that thing because you're gonna damage yourself. I'm gonna show you why in a minute. So as I mentioned before, this is a ball and socket joint. So, but actually this is more similar to this socket. And because this is shallow, it looks more like this. So when you have dislocation, yeah, that goes out and to the side. So if you can imagine, if you want to smash something, yeah, smash your shoulder to put it back there, you're gonna smash this orange in a half. So it actually can cause damage to the humeral head, and you can cause the damage to that side as well. So in that case, you probably have to do some traction and then just to pull that ball back to the socket, but never do it alone. Never ask your friend from the training to pull it back. You need to go to hospital and undergo a procedure, probably under anesthesia, because it's really painful And if you do it by yourself, it then may be very unstable. It may not heal properly. So always be careful. Don't smash your shoulder against the wall. Probably you won't be able to do this because it's very painful anyway. Another structure that I see being injured very commonly in jiu-jitsu is actually here. That's acromioclavicular joint. There is actually a small gap between it in real life, and it is surrounded by ligaments. The ligaments will hold this in place. And usually when you fall on outstretched hand, you can damage that that joint. It happens in different impact injuries as well, impact sports, very often in rugby, wrestling, but generally it's caused by impact. So I've seen this while my friend was fighting, and actually he was fighting in a cage, MMA, and he locked the triangle on the guy, and the guy smashed him down and it popped. Looked like actually a fracture of the clavicle, because when those ligaments tore, those muscles here like traps, etc., this will lift this up and separate it from the scapula. So they thought he broke the collarbone, but it was obvious to me that it's only that joint separation. Obviously you need the surgery for that, you need a reattachment for that. In terms of fractures, usually collarbone. Remember when I was talking to you about rotator cuff? This is also another type of injury. You can have rotator cuff tears. In every excess motion, you're gonna put those tendons of those muscles. You need to put them on stretch, and then if you break that barrier, they can actually tear. So, for example, those are external rotators of the shoulder. So your shoulder will actually move outwards. That's external rotation here. So in order to stretch them, you need internal rotation. And what we showed before is when you do kimura, you can actually do internal rotation this way. So you can damage the rotator cuff while doing kimura. Very often you've got injuries to the elbows with kimura and americana, because like we mentioned, this joint complex is very movable. So usually the least movable joint in that sequence gonna go, which is here, but I'm gonna tell you about this in another video. So those are another injuries to the soft tissues. Usually you've got tear of the supraspinatus tendon, and obviously that is a medical procedure. If you've got this muscle torn, you won't be able to elevate your shoulder, your arm. You're gonna use your actually shoulder here to lift it. So if I can maybe show you like this, so you won't be able to move it like that. You're gonna be trying to lift it like this. So for non-traumatic injuries, overuse syndrome, tendinitis, tendinosis, bursitis, you usually do conservative treatment, ice, rest. You may use some anti-inflammatories if it's advised by your doctor. You may use local corticosteroids. You need to be careful with that, because that weakens actually the tendons, ligaments by around 40% for about 8 months or up to a year. So, but if you need to do it, if you must, then obviously it's really good. For grade 1, grade 2 tears, maybe grade 2, it depends, but definitely for grade 1, strengthening exercises for rotator cuff muscles, for general shoulder structure, very beneficial, I found in acute stages of shoulder bursitis or tendinitis is sonophoresis, which is the ultrasound with anti-inflammatory medication. For more prolonged conditions, maybe shockwave therapy, that may be really helpful. Generally consult your physiotherapist, your therapist, your doctor, and they will advise you what to do. I hope you enjoyed this video, and please watch my next video. I will try to create something about elbow injuries in jiu-jitsu, and if you have any suggestions of what would you like to see, what subjects, and maybe in terms of production of the videos, I'm an amateur and I'm just starting, so maybe if you have any suggestions, maybe you want to see more images or something, then I will try to do that. For me, it's also a learning process, so enjoy it, forward it to friends who suffer with injuries, so friends who train jiu-jitsu, MMA. Maybe that will help them to understand what's happening with the joint and what not to do. Like I mentioned before, the adjustment of your shoulder when it pops out is not really good idea if you do it by yourself, but at least now you know why. Okay, see you later.